Assalamu alaikum. I am Prof. Firdaws Ahmad. My review is about the protective effect of some medicinal plant on liver injury and some biophysiological parameters. The purpose of the Presneter review was to find out the effect of some edible plant like tart cherry, Annona, vinaigrette, turmeric, and apricot kernel on human health. Medicinal plants were very commonly available in abundance in the tropics. Apart from the use in the treatment of illness through self-medication, these medicinal plants are valuable for modern medicine in other ways. The relatively lower incidence of adverse reaction to the plant preparation compared to modern pharmacological is encouraging both the consuming public and national healthcare institutions to consider plant medicine as an alternative to synthetic drug for healing and treatment of disease. First edible plant was the tart cherry. Was used as a protective has a protective effect of powdered tart cherry supplement and eating local Iraqi tart cherry fruit on moderate to border level of uric acid and lipid profile in a human serum. The protective effect of short-term supplementation of powdered tart cherry supplement and eating local tart cherry fruit in the north of Iraq in managing hyperlipidemia and relieving the pain of gout. 4 human groups were recruited, 2 for moderate to border level of uric acid and 2 for moderate to high hyperlipidemia patient. Local tart cherry fruit compared with those receiving freeze-dried tart cherry powder capsule will be an essential preventive measure against the development of dyslipidemia, along with a significant lowering of serum uric acid, especially for border level of serum uric acid patients without medication was found. The other edible plant was the Annona, Muricata, and curcuma. Their effect on the biophysiological level in carbon tetrachloride induced liver fibrosis in rat. Annona Muricata, which is the most important phytochemical isolated and characterized from these plants, was the acetogenin. Also it had the lactone and alkaloid tannin and coumarin. Curcumin and Annona Muricata combination have a number of therapeutic properties, including antioxidant activity and induction of tumor cell apoptosis, also the protection against the lipid peroxidation and maintaining the activation of antioxidant enzyme at high level. Now, the most important compound in the Annona Muricata bulk was the acetogenin. Acetogenin are inhibitor of complex 1 of the antioxidative phosphorylation chain, thereby block the formation of ATP, the energy it needs cell cancer to operate the pump phosphoglycoprotein mediated. The acetogenin also inhibit apiquinone oxidase, the NADPH depending enzyme that is peculiar to the plasma membrane of the cell cancerous. The acetogenin is a long-chain fatty acid having a direct action on the mitochondria, the ATP, the Golgi particular apparatus, and plasma membrane. Also, destroying the cancer cell without harming healthy cells. Where the acetogenin are the mono. If you notice here, the acetogenin structure having many the OH functional group, also the furan, which is responsible for their antioxidant effect. Also, their seeds having the same high concentration of the acetogenin, but it is until now they believe that it is toxic. So it need more research about the seed and how the researcher can use it as a drug in a suitable concentration. About the curcumin or turmeric, having two other curcuminoids are this methoxycurcumin and this-methoxycurcumin, which are the natural phenols. About the other medicinal plant was the apricot kernel, also the vinegaric. Studies showed that carbon tetrachloride injection caused a significant alteration in histological and the biochemical parameter in rat. But with turmeric and combination with turmeric and annona and turmeric alone, vinegaric, apricot, kernel treated group show a significant lowering level of aspartate aminotransferase, alanine aminotransferase, direct bilirubin, and increasing liver glutathione, the antioxidants compound. Also, the superoxide dismutase, the SOD level, there was an increasing in the SOD level, decreasing the YPC, red blood cells, and platelet. About the histological paraffin section of the rat treated with the apricot kernel treated group, the histological structure of liver showed more decreased degeneration of the hepatocyte, and it appeared normal epithelial cell than the other. It means here, under the apricot kernel treated group is having more decreased degeneration of the hepatocyte and normal epithelial cell than the effect of the other plant. Now, if we notice the histological section of liver, the normal one here, showing the hepatocytes, which is represented by the black row, and with polyhedral in shape with obvious nucleus and the blood sinusoid and central vein, CV. About the second one, the paraffin section of the rat liver treated now with the carbon tetrachloride, which lead to the hepatocyte were degenerated and represented by D, and congestion of blood, black row, and inflammatory leukocyte infiltration, the white row, were observed. Now, figure 3, the combination of annona and turmeric, the effect of the combination of annona and with turmeric on the rat liver treated with carbon tetrachloride. Most of the hepatocytes appeared normal, but a few of them were degenerated and a few papules still noted. While the paraffin section of the rat in figure 4, liver treated with the carbon tetrachloride and apricot kernel, we notice that a few degenerated hepatocytes were observed and it appeared mostly normal. It returned to the normal one if we compare it with the figure 1. Conclusion, these studies suggest that the daily consumption of 300 milligrams of cherry tart fruit for 6 weeks significantly improves the biomarker of dyslipidemia and inflammation more than its powder, significantly lower serum total cholesterol, LDL, triglyceride, and significant increase in serum HDL. and they will have a high degree of interest in significant lowering of serum uric acid, especially the border level with non-pharmacological therapies, and especially the fruits that exist cheap in north of Iraq instead of its capsule that is expensive and not present in this region. The other edible plant, Annona, vinaigrette, turmeric, and apricot cornea, have shown a hepatic protective effect of increasing the liver SOD level and ameliorated inflammation caused by the carbon tetrachloride treatment by decreasing of the white PC and lymphocyte count. Moreover, all plants except turmeric decrease the thrombogenic activity of carbon tetrachloride through decreasing of platelet count. From the histological point of view, carbon tetrachloride causes a hepatotoxic effect in male rats, degeneration of the hepatocyte, inflammation in the liver section, and degeneration of the epithelial cell were observed. Administration of this plant extract give a good result in ameliorating these changes and normalize the liver structure. Thank you for your attention.